Hi, my name is Blaine Ringowitz and I'm a nurse practitioner. Let's focus on the clinical assessment. Now that we understand how to test for syphilis, let's get key information. In this next part, we're going to learn how to get key information from the past medical history and the sexual history. This will help inform us about risk factors as well as prior treatment history. Let's start with the past medical history. It's important, in addition to the questions that you would normally ask, for patients who can get pregnant, asking how many times they've been pregnant, how many times they've given birth, and if they were tested for syphilis during each pregnancy. Taking a detailed sexual history helps understand individual risks for syphilis or potential exposure. We will follow the CDC's 5 Ps framework for taking a sexual history. Start with open-ended questions and follow up based on the patient's responses. Anyone on the care team can get this information, or you could use a questionnaire in your medical record. If someone is asking the questions face-to-face, they can be done in 5 minutes or less, depending on training provided and comfort level. Note that some questions might only be appropriate if you have additional resources or referrals for identified needs. The first P of the 5 Ps is for partners. Ask how many partners have you had in the last 3 months? What gender are your partners? Do your partners have sex with other people apart from you? Do you have male partners that have sex with other men? The second P is for sexual practices. Essentially, you want to know what body parts are involved in sex and how often condoms are being used during sexual contact. One way to ask these questions is, many people have different types of sex. What parts of your body do you use for sex? For each sexual contact, ask, when was the last time? And how often do you use a condom with oral sex? Always, sometimes, rarely, or never. The third P stands for past, particularly past history of STIs. There are 3 main questions to ask here. Have you had an STI in the past? When? Where on your body? How were you treated? Were your partners also treated at the time? What STIs have your partners had in the past? When? Were they treated? Were you treated at the same time? When was your last HIV test? What was the result? The fourth P stands for protection or prevention of STIs. This is an opportunity to ask how your patient currently prevents HIV and STIs and provide some counseling on prevention strategies that may be helpful. You can ask, have you been vaccinated against hepatitis A, Mpox, or HPV? These are all viruses a person can get through sexual contact. You can ask, what do you know about PrEP, a medication to prevent HIV? Follow-up questions could include, have you ever been on PrEP, or would you be interested in learning more about PrEP? Do you think PrEP might be suitable for you? What do you know about doxypep, a medication to prevent STIs like syphilis, chlamydia, and gonorrhea? You can use the same follow-up questions as I just asked. How often do you currently get STI and HIV testing? How comfortable are you negotiating condom use with your partners? Or, you said previously you rarely use condoms. Condoms can help prevent STIs. What would it take to increase your current condom use? How comfortable are you about asking sexual partners about their STI and HIV status? The 5th and final P stands for pregnancy or parenthood. A client-centered way to start the conversation is to ask, do you think you'd like to have children or have more children at some point? Then you can ask follow-up questions such as, when do you think that might be? And how important is it for you and your partner to prevent pregnancy until then? If they are interested in pregnancy prevention, then discuss referral to appropriate services for birth control or provide birth control if appropriate in your clinical setting. You can find additional resources here. Let's do a knowledge check. Question 1. Which of the following is not an example of an open-ended question for taking a sexual history? A. What types of sex do you have? B. How many partners have you had sex with in the past 12 months? C. Do you use condoms during sex, yes or no? D. How would you characterize your sexual orientation? The correct answer is C. Do you use condoms during sex, yes or no? This is a close-ended question that can be answered with a simple yes or no, unlike the other options which encourage more detailed responses. Question 2. Which of the following is not a benefit of taking a comprehensive sexual history? A. Identifying patients at risk for syphilis and other STIs. B. Guiding appropriate sexual health counseling. C. Determining suitable anatomic sites for STI screening. D. Prescribing antibiotics without testing. The correct answer is D. Prescribing antibiotics without testing. If you got all the questions correct, excellent job! If you missed any of the questions, don't be discouraged. We recommend reviewing the video for better understanding. Learning is a journey, so keep exploring. Thank you for joining us for key components of the clinical assessment: past medical and sexual history. In the upcoming videos, we'll cover Part 2 of the clinical assessment, treatment and prevention strategies. Let's continue learning together.